Acute care is when a child gets really sick, and it's very scary for families, and it's also scary for providers who don't always encounter sick children. Children get sick in different ways than adults. They do well for a really long period of time and then suddenly can get very sick.
There's a real opportunity in our province to have a more coordinated approach to how we research acute care.
Research into the enhancement of acute care for children's health, or REACH as we call it, brings together 25 physicians, nurses, researchers, administrators who are really involved in the care, education, and research in acute child health.
REACH is a very exciting research team that's coming to the Children's Hospital Research Institute of Manitoba because it's going to be looking very thoughtfully and systematically at how we take care of sick children across the province.
In order to do meaningful and impactful research, you need to do it alongside the people that it affects. Collaboration will play a key part in this research theme, all the way through having clinicians who are working in the acute care settings, the parents and the families and the children that are visiting these settings.
Being involved in research kind of puts the power back on us, that we can make change and we can do something for our kids, when in that moment in hospital we didn't really have a lot of control or power in that situation.
People who wouldn't normally work together are now brought together under a research team to achieve a greater good. That collaborative, team-based approach will make us so much stronger and really capitalize on many of the strengths we've been building in recent years.
To effectively advocate for a change, we need robust data to provide evidence, to be able to make decisions that can improve care.
It's really critical that we start to look at how we can better support people taking care of really sick children so that we can better support families, get them the access to care and information that they need to help care for their sick child, and get them to the right place at the right time.
It gives me comfort, as a parent going in with your kid, that the people who are taking care of your child in that moment are doing things that are based on best practice.
With quality research work embedded in acute care setting, the likelihood of having improved outcome in children is high.
Ultimately, we want to improve the health of children and families who seek acute care in this province. We want their outcomes to be better because of the new knowledge we've discovered, and that through knowledge mobilization, the research that is there will get used.
We want to have long-lasting infrastructure in our province so that acute care research can be done and that it can improve the health care of children who are sick and injured and the experiences they have when they're in the healthcare system.